I'm a physical therapist and I specialize mainly in orthopedics and sports physical therapy. But I also work with a lot of people in different populations. So today's topic is going to be about cardiac physical therapy. Um, this is one of those realms in physical therapy that if you're not really paying attention to, you can kind of miss a lot of signs. So as an orthopedic physical therapist, I see a lot of people when they have like back pain, neck pain, shoulder pain, they might have some jaw pain. And a lot of these symptoms can also be related to cardiovascular disease. So I need to keep my eyes open and I need to be very vigilant on making sure that I'm checking people to see if they have heart risk factors. So many times I've seen people in the clinic and they come and they have like shoulder pain, back pain, but their blood pressure is like 190 over 100, or their heart rate is at 120 when they're sitting down. And these are signs that they need to not do physical therapy today. This is signs that they need to go to the emergency room, or they need to call their doctor to make sure that their medications that they're supposed to taking, everything is fine with that. So just because I'm an orthopedic physical therapist, that doesn't mean that I also don't have a lot of experience in cardiovascular disease. And this is something that I want to teach you guys about today. Um, so before we start anything, I want to ask the whole group and just, with a show of hands, raise your hand if if you've seen a cardiologist last year. Just raise your hand so I can see how many people have talked to a cardiologist in the last 12 months. Okay. So I see a good amount of hands, maybe like one out of every four people, one out of every three people have seen a cardiologist. Good. How many people have had any cardiovascular testing done, like an EKG or a stress test, anything like that? Who's have that done? Raise your hands. Okay, so a good amount of you guys. So that's really good. So a lot of this information, hopefully your doctors have been able to explain to you. And they've also been able to explain to you how you can take specific action to start improving your cardiovascular health. Okay. One more show of signs. Can then anybody raise their hand if they've had, uh, it's okay if you don't want to raise your hand, but it would help everybody else if you can share your experiences later on. If you've had a heart attack, if you've had like a bypass surgery or anything more invasive, like stents put in, if you had any kind of invasive procedures done to your heart, can you please raise your hand? So like stents, bypass, any kind of thing like that. So a few of you have. Good. So I think I saw maybe like 8 or 9 hands. So good. Later on, after everything is done, please talk a little bit about your experience, and we can also learn from this like together. So again, so this today's topic is about cardiovascular disease and how physical therapy can help. Number one, diagnose and identify if you have some general condition, and then how can we help you treat it so your cardiovascular system, your heart and your lungs can get stronger and you can do more activity without feeling or putting your heart at risk of getting a heart attack or other procedure. Okay. So before we talk a little bit about the treatment, let's talk a little bit about the disease. So cardiovascular disease, also known as heart disease, is many different things. That's a general term. And the people that typically diagnose these kind of illnesses are your primary care doctors. They're like the main people that will identify and diagnose these things. So everybody here, you need to have a really good and strong relationship with a primary care doctor. If your primary care doctor is not checking these things and they're not looking at your heart, they're not like, even if you go for like a sick, even if you have like a cold, if you have like some shoulder pain or back pain, they should still be looking at your heart. So make sure that your primary care doctor is very much in top of this, because they're also going to be the doctors that will be sending you to get your blood tests done every year. And then if there's something wrong in what they see, then they'll send you to a cardiologist. So those two people are the main providers that you need on your team. A good primary care doctor is the most important person. They're like, in terms of sports, they're either like, they're the coach. They're the coach and everything. So they're gonna make you're the player in a team. Your coach is gonna make sure you're doing everything the right way. Okay, so your primary care doctor is your coach. All right. Your cardiovascular doctor is like your assistant coach. He's like a specialist. So they might help teach you about one part of the game, and then they'll make sure that you're doing that part really well. Okay. So those are the two most important people you guys need on your team to help you manage your cardiovascular disease. All right. So what is cardiovascular disease? So there are a few things, like high blood pressure is one of the common things that a lot of people have. And just by your show of hands, how many people here have been told that they have high blood pressure? Raise your hand. So a few people. Okay. Good. How many people here have been told they have something called coronary artery disease, which means there's a little bit of plaque in the arteries around your heart? Raise your hand. So less people with this. So more people with high blood pressure, less people with coronary artery disease. Okay, good. So these are like the main two things that I want to talk about today, because those are the main two things that can contribute to every other problem in the heart. Okay. So again, what is the heart? The heart is a muscle. First and foremost, it is a muscle. And like any muscle in your body, like your arms, your legs, the muscles around your neck and your shoulders, they need certain things to make sure that they're strong and then they're fit. Like if you see somebody at the gym, or if you know, like an athlete that's very strong, they do a lot of exercise on their arms, their legs, their muscles in their stomach, the muscles in their back. And that's no different than how we need to treat the muscle of your heart. Okay. And for any muscle in your body, you need oxygen for the muscle to do its job. Okay, so even the little muscles in your stomach, even the muscles in your eye that controls your eye movements, even like the muscles like in your throat that pushes food down into your stomach, all of those muscles need oxygen, and that's no different than the muscles of your heart. Okay, but the main difference in that is when like when your doctors like go into your arm to get blood drawn, those arteries and those veins are really thick. Like their diameters that you can kind of see them. And if somebody pulls it, you can kind of like, you can play with it, you can stretch it, you can move it around. They're pretty big. But the main arteries in your heart that need to give oxygen to the muscle of the heart, they're really small. So I want to show you guys just like a quick picture. I want to see if I can screen share. All right. Can everybody see this picture of the heart? Just nod yes if you can see it. All right. So this is like what the shape of the heart looks like, and these lines that are coming down, like the right coronary artery disease, coronary artery, the left coronary artery. These are all little arteries that give oxygen to the muscle of the heart. Now, the problem with coronary artery disease is that these little arteries, they can get blocked if you have a lot of plaque in them. So now if this artery, your right coronary artery disease, gets blocked, this whole part, that whole part of the heart muscle does not get any oxygen. And what's going to happen, what happens when that part of your heart doesn't get any oxygen? It doesn't contract. It doesn't do its job. It doesn't keep pumping blood. Okay. Who here knows what happens to, let's say, your foot if there's no oxygen that's reaching to your foot? There's something called gangrene that can happen. And what that basically means is that part of your leg dies, or that part of your toe that has no more oxygen, so it's just not functioning anymore. It's a dead toe. And that's something that's very common, but that can also happen to your heart. If there's no oxygen going to your heart muscles, that part of your heart muscle can die. And that obviously is not a good thing to happen. All right. So that's like a brief anatomy of the heart. The heart is a muscle. There's 4 chambers of the heart. again, like this stuff is not that important. The most important thing to know about the heart is that it needs to pump, right? Just like your arm muscle, it needs to pump to like lift your arm up and down like this. Your heart does the same thing. It pumps to send blood through your whole body. And the only way that happens is if there's oxygen reaching that muscle. If there's no oxygen reaching my arm, I can't do this. This is not going to happen if there's no oxygen getting to my arm muscle. And same thing with your heart. If there's no oxygen getting there, then it's not going to pump. Okay. So now let's talk about a little bit about who is at a high risk of getting cardiovascular disease. What are the main risk factors? Okay. We're gonna break this into like two categories. One is like these non-modifiable risk factors, which means these are risk factors that cannot change. This is just what it is. And then there's other risk factors that are called modifiable risk factors, and those risk factors can change based off of the things that we want to do too. Okay. So things that you can change: your age. If you're over the certain age, if you're elderly, you are at a higher risk of getting cardiovascular disease. So somebody that's 30 years old has less likely to have cardiovascular disease compared to somebody who's 70 years old. That's something that you can't change. You can't change your age. If you can figure out how to change your age, you would be a billionaire, and everybody would, work with you. But that's not something we can change. Okay. Another thing that you can change is, so men are more likely to have cardiovascular disease than women. That is not changed as you get older. Okay. So if you look at a 30-year-old man and 30-year-old women, a 30-year-old man is going to have a much higher risk factor of having issues with their heart. As you get older to like 70-year-old men and 70-year-old women, you still also have a much higher chance of getting cardiovascular disease or heart disease than a woman does. Part of the reason of that is women have a higher level of estrogen in their body. And as long as you have that hormone, it does have a protective effect on your heart. However, if you've been post-menopause, your protection is a little bit less. So women that have been post-menopause, you still have a less chance of getting a heart disease compared to a man. However, that protection is a little bit less after menopause. So that's another thing we can't change. You can't change if you're genetically a man or a woman. You can't change that. Another thing that is not something that you can change is also your family history and also your race. So certain races have a higher chance or higher likelihood of having heart disease, and part of that is related to genetics. Asian Americans like me, people from Asia, people from the Pacific Islands, people from Africa, a lot of people in our communities are at a higher risk of having cardiovascular disease. And that's not anything that you can change. But even more specifically than that, like as I'm an Asian American, I have a higher chance of having heart disease than somebody who's like of a Caucasian descent. And this is just statistics, but even more than that, my immediate family history also makes me at a higher risk of having heart disease as well. So if your parents or your grandparents, or if your aunts and your uncles have a history of heart disease, that is also something that is also a risk factor that you might also have heart disease. And that's not something you can change. You can't change who gave birth to you. And that's one of the non-modifiable risk factors. So those are like the main risk factors that you can change. However, there are a lot of risk factors that we can change, okay? Some things like if you smoke, if you smoke a lot or if you smoke at all, you're at a higher risk of getting heart disease. So what's one thing you can do to reduce your risk is by quitting. So even if you've been smoking for 20 years, yeah, you have a higher risk of getting heart disease. But once you quit, your risk goes a little bit less. Not all the way down. You can't undo the damage you've done from smoking, but you can come down a little bit. Okay. what else can you, like if you have other things in your body like high cholesterol, like for example high cholesterol, diabetes, like high sugar, things related to your blood values, if you have anything abnormal there, that is something that you can change with diet and exercise. So if you have high cholesterol, and high cholesterol, like the numbers that matter are like the total cholesterol and then also your LDL. If both of those numbers are really high, that's not a good sign, but you can change that by eating a little bit better. So eating foods that are, less oily, less carbs, less salt in your diet, things like that can really help to reduce your risk to a better place. If you have high blood pressure, that's also something that is a risk factor of other heart disease. And that's something that you can change either by medication, lifestyle changes, or diet changes. Things like meditation, things like, light exercise, like yoga, Tai Chi, walking are all really good things for your blood pressure to improve. And that all reduces your risk of having other cardiac issues. There's a long list of other modifiable risk factors, but those are the main things that I think that we can very easily work on. If you drink a lot of alcohol, that's also a high risk of getting heart disease. So by cutting back a little bit, that's going to reduce your risk. If you have a very stressful lifestyle, or if you work, crazy hours, um, then you do have a higher risk of getting heart disease. So things like, taking breaks, going on vacation, spending time with your hobbies and doing things that are fun for you, enjoyable for you, that also reduces your risk. Having fun and stress relief and being happier is also a really good thing for your heart. Okay, so smiling more, being less stressed out, spending time with the people you love, that's really, really good for your heart. Um, and this is not me saying this, this is what like the evidence and research and the scientists are saying also. Um, Again, these are all things that you can change. If you have a very stressful lifestyle, um, again, this is lifestyle related. So if you're somebody that, like wakes up at 7 o'clock in the morning, goes straight on their computer, starts working nonstop, doesn't take a break for lunch, works until like 6, 7 o'clock, comes home, eat dinner, then is back on the email, like checking and responding to certain things. You can change that, and it's not something like, it's not something that it's very easy to change sometimes for some people, but that is something that you can change. You can make better work habits. You can make better life habits so that you are, better at managing your time, better at managing your life, and better at managing your stress. And that's something that I think is very important for a lot of us to understand. Um, okay, so those are the risk factors. And we talked a little bit about some of us have heart disease, some of us have been getting tested, which is really good. But now, what else is the most important thing? Okay, so to summarize everything, I think the three most important things is number one, talk to your primary care doctor about heart disease. Ask them questions, see if they want to do any kind of testing. And if they say no, that's not a good thing for a doctor to say to somebody who's over the age of 45. Even my doctor right now, I'm 30 years old. My doctor right now wants to make sure that my heart is strong. Same thing for you. So like you need to get your blood tested. You need to get like an EKG, right? So those are all things that need to happen. Number two, talk to your cardiologist. If you have any issues with your cholesterol, if you have any issues with diabetes, high blood pressure, it's very important to get a stress test. Um, if you have, how many people here have not had a stress test ever in their life? A cardiac stress test. Raise your hand if you've never had a stress test. I can't see a lot of people's cameras here, but okay. So if you've never had a stress test, I would say one thing is please talk to your doctor, have them give you a referral for a cardiologist and get a stress test now so that later on, if there are any issues with your heart, they can compare it, right? When you're healthy, that's the best time to do these tests so that when you're sick or you have some symptoms, then they can compare it to the previous time and they can see what's wrong or what's different. And then they can make a much better diagnosis. If you wait until after you had a heart attack and then you get a stress test, your stress test is already going to be abnormal. And your stress test will always be abnormal after that. But if you had a stress test done when you were healthy, and then if you had some, some light chest pain, some light symptoms, they could have checked it again and seen, like your heart muscle isn't getting that much oxygen. Maybe we need to do another test like an angiogram. Let's see what's happening to the system. And then if they did that on time, then maybe they could have given you some medication. Maybe they could have put a stent in. They could have done something so that the heart attack never happened. And that's what's very important. So if you've never had a stress test, that's the third most important thing. Get a stress test. Talk to your doctors about anything. Well, that's the second thing. So number one, talk to your primary care doctor. Number two, get a stress test. Number three is what we're going to talk about now. Okay, so this second half, how can physical therapy help with heart disease? You need to be active. Like increasing your activity is the most important thing to do to recover or improve your heart disease. Okay, so like I said before, like any muscle in your body, like your arm is a muscle, and the only way this muscle is going to get stronger is if you exercise it. Your heart is no different. It's a muscle, and the only way your heart is going to get stronger is if you exercise it. Okay, so before I show anybody what cardiovascular exercises look like, I want to teach you guys what are some things that you should be doing, or what are some things that you should be looking at before you exercise your heart. Okay, because this is very different. Like if I work out my arm too much, if I exercise and my arm gets hurt, it's fine. Like it's not that big of a deal. My arm can recover in like 3 to 4 weeks and I'll be fine, right? But you don't want your heart to get injured. Like that's something that is not okay. If I sprain my knee, if I hurt my hip or my back, it's okay if that body part is injured. It is not okay if your heart gets injured because of exercise. So there's two things that everybody needs at home in order to safely and smartly exercise your heart. And I'm going to screen share with you what that is. Okay. So this is one thing over here. This is called a pulse oximeter. So this device is going to tell you what percent of your blood has oxygen in it. So you want something as high as 97, 98, 99, or 100% means your blood has a lot of oxygen in it. Okay. If that number starts dropping down, that's a bad sign. That means that your body is not giving enough oxygen to your blood. And then if your blood doesn't have enough oxygen, then all of your muscles won't have enough oxygen, including your heart. So this is a very important piece of equipment to get. Again, all of these things are very easily available at like Costco, Walgreens, CVS, on Amazon. Tons of options. They're all pretty similar in terms of use. So you don't have to worry about getting the best one or the most expensive one. Like this one is $25, but there's some pieces that are up to like maybe like $16, $17, $18, and then there's some pieces that are like $50, $60. So something in the middle is typically like the right answer there. Okay. And this is the other thing that I think everybody should get. This is a blood pressure cuff. Very important. This is something that I think is underrated. What I mean by that is like when you regularly check your blood pressure, you can really learn a lot about your body. So somebody like with blood pressure, it's one of those things. You can have high blood pressure. It can be like 100, it can be like 180 over 100, or it can be a really good blood pressure, which is like 120 over 80. You will feel exactly the same. So there's no symptoms of high blood pressure. The only way to know if you have high blood pressure is by checking. You're not going to feel it. You're not going to have pain. You're not going to have like tiredness. You're not going to have fatigue. You're not going to have difficulty breathing. You're going to have no symptoms of high blood pressure most of the time, but you're going to have it. So the only way to know about it is by checking your blood pressure regularly. Again, this is just one brand that I've used, and this is one that is most commonly, sold and used in doctors' offices, Omron. But there's many different types. There's ones that you can wear on your wrist. there's like some blood pressure cuffs there's some blood pressure cuffs you can wear around your wrist. There's some blood pressure cuffs that go around your arm. Either way, they're all typically good. What I like to do is I like to compare an electric blood pressure cuff to a manual one. So I use a manual one for work. It's just a little bit faster for me. So for me, like, the faster I can get a reading, the better. But these typically are in a very accurate range too. And those are the two things that you need for smartly and more appropriately exercising your heart. Some devices like a watch, like, so this is like a Samsung watch. For me, like, this can measure my heart rate, and I don't know if you guys can see here, like, it can measure my heart rate. It can tell me if it's a little bit too high, too low. It can also like tell me my oxygen levels, and it can also read my EKG on this. So it has some fun tricks and some fun tools. Like, there's like these like little things. You can also use like a smart watch now. They're becoming really advanced in with their heart and their health monitors. So the Apple Watch is great. The Fitbit I think Sense or Versa, those are really good. Samsung watch, I use Samsung products, so I have a Samsung watch. These watches are also really good health monitoring devices. Now they can also tell you your EKGs. They can also tell you your heart rate. They can tell you your oxygen levels. The only thing they can't tell is your blood pressure. So you will need a blood pressure device at home. Especially now, like, you don't want to go to like a pharmacy to get it done, because why go to a pharmacy when you can just do it at home? It's safer to be at home. So those are the two things that you would need. And how do you use these pieces of equipment during cardiac therapy? So the thing that you need to do is you need to check your heart rate, your blood pressure, and your oxygen levels before you exercise, when you're exercising, after you're cooling down and resting, and then also like 2 hours later. So there's gonna be 4 times a day on the days that you're doing cardiac therapy that you need to check these numbers. And again, it's tedious, it's time consuming. It does take, an extra 2 to 5 minutes of your time. But that's how we know if the exercise you're doing is too much, is it just right, or is it not heavy enough, or is it not like giving you enough exercise? Okay. And what I mean by that, yeah, somebody has a question.
Excuse me, how much it should be the heart rate?
Yes, great question. That's exactly what I'm saying right now. So the general guidelines, and everybody write this down if you have a pen or a piece of paper, okay? For your heart rate. If you're resting, like right now I'm sitting, my resting heart rate should be anywhere from 60 beats to 80 beats a minute. 60 to 80 is a normal range. If you are more active and you have, more endurance and you're exercising a little bit more, it might be around 60 to 65, and that's good. Or if if you were just walking around, you just sat down, it might be around like 75, 80, and that's still okay. So this is your heart rate, okay? Blood pressure, there's a range. So a normal range of blood pressure, like the top number, so blood pressure is like 2 numbers, your systolic and diastolic. So the first number, you're like the number that's typically the higher number. The normal range is anywhere from 110 to 130. Okay. The bottom number, the normal range, is anywhere from 70 to anywhere like 84, 90, like anything between, let's say, 70 to 90. Anything outside of that range, up or down, it's not a good sign. Signs could be you might have high blood pressure, or the other sign could be you're dehydrated and you don't have enough water or fluids in your system. So if it's too low, if your blood pressure is like 90 over 60, that's really low. We need to get that up a little bit, because you're going to have less energy, you're going to have less strength. So you might need to drink a little bit more water. You might need some electrolytes. You might need to eat some food and get that blood pressure up. Now, if your blood pressure is something like 146 over 90 or 146 over 84, that's high blood pressure. Like, no sugarcoating this. That's high blood pressure. Okay. Now it's not unsafe blood pressure to exercise. You can exercise when your blood pressure is like 146, even like 154. You can exercise at those numbers, because that's when, if you exercise later on over time, your resting blood pressure is going to go down. Okay, your heart will become stronger. It's going to pump blood easier. Okay, but if your blood pressure is so high, like if it's 180 over 100, that is not the time to exercise. So even right now, when I'm seeing patients at home, or in, like, online, or if I'm seeing patients at their home in the hospital, if their blood pressure is 180 over 100, I tell them, hey, we need to call your doctor. We need to maybe like rest. Maybe we need to lay down and, do some deep breathing exercises to relax your body. And we need to check your blood pressure again in 5 minutes. But for those 5 minutes, they're just resting and maybe a little bit of light stretching, but we're not doing any kind of strength exercise at all, because it's too high. Because if it's at 180 and then we start exercising, it can go up to 200. That's not safe. So this is why I think it's very important to make sure that we're checking these numbers before you exercise. Okay. So we talked about your blood pressure, your heart rate. In terms of your oxygen, like anything over 95% is normal, but anything around 97 and up is good. Okay.
Excuse me.
Yeah.
Doctor, મને રાતના કોઈ વાર ઊંઘ ના આવે તો પ્રેશર વધારે થાય સવારના?
We can talk about that a little later. Ask me that a little bit later. Yeah. But these are like the main numbers that you need to know when you're exercising. Now, when you're doing, if you've had a heart attack or if you had a bypass surgery, there are more important things that also need to happen. You need to have your EKG, like they have like monitors that go around your chest. You can have watches now that can also measure your EKG, but we're looking for changes in that. Now that's a little bit more advanced for everybody here, for a general population, but the heart rate, the blood pressure, and the oxygen are things that you need to check. All right. So now when you're exercising, how do you exercise to get your heart stronger? Okay. The good thing about this is it's no different than exercising your arms or your legs or your back. It's no different. Before you exercise your back, you need to warm up, right? You need to do some light stretching. You need to do some gentle movements to get your body ready to lift. So if you're an athlete, if you're exercising your legs and your back, you need to do some light movements to get your legs moving. And that's no different than exercising your heart. You need to start with the warm up. Okay. So that's phase 1. Phase 2 is like the main activity. This is like the main lifting that you're going to be doing, or the main exercise you're going to be doing. And then very important, after that, you need to cool down. Okay. The cool down is the most important thing. Well, the warm up and the cool down are the most important things for heart disease. The most common times that people get heart attacks is when they don't cool down. They do something really active, really intense, and then they just sit down or they just lay down. So now their body and their heart didn't have enough time to like slowly, gradually come to rest. It just happened too quickly. And then the heart didn't get enough oxygen, and then they get a heart attack. So the cool down is very important, and then rest. So it's warm up, main activity, cool down, and rest. Those are the 4 phases that you need to go through for any kind of cardiovascular exercise or fitness. And does anybody want to see like what certain things look like for fitness? Just raise your hand if you want to see what are some exercises that you can do for your heart. All right, so good. I see a few hands. The best part about this is exercising your heart is no different than exercising the rest of your body. And what I mean by that is, actually, let me backtrack a little bit. A lot of times what people think exercising your heart is by walking for a long distance. If you're walking for 30 minutes or 1 hour, or if you're bicycling or on a treadmill for 30 minutes or 1 hour, that does not mean that you're exercising your heart. Okay, that's not what cardio exercise is. Cardio exercise is is exercise that gets your heart rate up. That's the important thing. Your heart rate needs to come up. If you're walking slowly outside, if you're just walking at a very casual pace, if you're just like walking like this kind of like slow speed outside, and you're walking for 1 hour, 2 hours, 3 hours, 4 hours, whatever. If you're walking at this slow speed, if you check your heart rate, it's not going to go up. So for those 2 hours, 1 hour, however much you were walking, you did not exercise your heart. You were just walking. Okay. Or other people, like they like to exercise on a bicycle, right? So if you have a bicycle at home and you're pedaling, you're going at a slow speed, and you're doing that for 30, 40 minutes, but your heart rate doesn't go up, that's not exercise. So you need to walk faster. You need to add resistance to your bicycle. That's what's going to get your heart rate up. So what are numbers that you should look at? My resting heart rate is around 61 beats per minute. Okay. And let me measure it right now so I can tell you the exact numbers.
You don't have to park in the parking lot. You just go, wait in front of the store and to just pick it up. You don't have to park in the parking lot for the A1 stuff.
Okay, so right now my heart rate at rest is 66 beats per minute. So it's 66. So what I need to do is when I'm exercising, it doesn't matter what exercise I'm doing. I can, even just be marching with my arms and legs up and down. Like this is going to get my heart rate up a little bit. If I do this for 2 minutes, my numbers are going to go up to like 75 or 80. And that's what I want. I want my heart rate to go up. Other things I can also do are taking weights. So if I have weights in my arms and I do like exercises like squatting and then lifting my arms up and down, this is also going to get my heart rate up. So this is cardiovascular exercise. This is exercising my heart. And I'll tell you what it means. I'll do this for even 1 minute, okay? If I do this exercise for 1 minute, and this is what it looks like from the side. So I'm already getting a little tired. I can feel my breathing increase. I can feel like it's a little bit harder for me to talk to you when I'm doing this. And you guys can hear me breathing a little bit heavier also. All right. So I just did that for 30 seconds, not even for 1 minute. Whew. And I'm going to measure my heart rate again. So before it was at 66. Right now it's at 114. So that's what cardiovascular exercise needs to look like. Sorry, just 1 second. Let me get my breath. How do you know what numbers you should be looking for? Okay, so everybody again, write this down, okay? This is a formula to tell you what heart rate you should be working at, okay? So 220 minus your age, okay? So my age is 30, so that equals 190 is like the maximum that your heart rate should ever go to, okay? So if your age is 60, 220 minus 60 equals 160. So that's your heart rate max. Anything higher than that, it's too intense of an exercise. In your heart, you're not supposed to be exercising at 100% intensity. You're supposed to be exercising at like 75 to 85% intensity. So now if you take 160, so if your age is 60, then the maximum you can get to is 160. So now if you multiply that by 0.75 is 120 beats per minute. Okay. And 0.85 is 136 beats per minute. So if your age is 60 years old, the range that your heart should be in for exercising your heart is around 120 to 136 is a good range for your heart rate to go when you're exercising your heart. Now, if you're walking outside, or if you're on your bicycle and your heart rate is at like 95 or 100, that's a little bit too light. You need to do it a little bit faster, or you need to add resistance and make it a little bit heavier, so your heart rate goes up a little bit more. Okay. Now, on the other hand, if you're doing something really intense, like if you're like jogging, or you're on a treadmill on an incline, right? If you're walking uphill on an incline and you're walking really fast and your heart rate is at 140 or 150, that's a little bit too much. You need to bring it down a little bit. So to bring the slope a little bit less, or walk a little bit slower, and then check your heart rate, and your heart rate, it should be in that range. Okay. So that's how we use this information. When you're before you exercise, we look at all of these numbers. When you're exercising, we check these numbers when you're exercising, and then we want to make sure you're in a good range. And then when you're cooling down, all right, so I just did this one exercise. I sat down right after. That's not good. I shouldn't have done that. So after I do these exercises, I need to just walk around for 5 or 10 minutes. Just, if I'm in my room or if I'm in my hallway, just walking up and down. I should walk up and down for like 4 to 5 minutes, let my heart recover a little bit, make sure my heart rate is starting to come down. Like it shouldn't go from 114 to 60 like in 1 minute. It should slowly come down. And then I should take a break and sit down. Okay. So that's kind of how we do it. The good thing about exercising your heart is that you can do any kind of exercise as long as your heart rate is increasing. Okay. The other things we look at is your blood pressure should not drop. If you're exercising so much and your blood pressure goes from 120 over 80 and it drops like 100 over 60, that's not good. That's unexpected. You need to rest. You need to take a break. We need to double check. We might need to send you to a doctor to see why did your blood pressure drop like that when you were exercising. Okay. If your oxygen is dropping, that means you're doing all of this work, but there's no oxygen. And if there's no oxygen, you're going to get hurt. Something bad is going to happen. This is like, especially with COVID, this is one thing that we're noticing. When people's oxygen levels are dropping, those are the people that are not recovering from everything that's happened. Okay. Same kind of thing with your body. If I'm lifting my arms, if I'm doing bicep curls, like just arm exercises, and at rest, my oxygen is at 100%, but now I'm doing this for like, 10 minutes and my oxygen is at 85%, I'm risking injuring my arm. My muscle can get hurt from that. And also my heart can get hurt from that. So those are the things that we look at. So that's kind of like a quick summary about what cardiovascular exercise looks like. I want to give you like the 3 main points. Okay.
Thank you.
You need to check your blood pressure, your heart rate, and your oxygen levels before you exercise, during exercise, and after exercise. That's number 1. That's the most important thing. Number 2, when you're exercising your heart rate needs to go up. If it's not going up, you're not exercising your heart. You're just having fun. You're walking, you're enjoying yourself, but you're not exercising your heart. Okay. And the third most important thing is you need to cool down. If you've been exercising properly and been exercising with your heart rate going up, you need to give yourself 5 to 10 minutes to walk a little bit slower, or, just do some light stretching, maybe some yoga or it's like some Tai Chi or something softer. Wait for your heart rate to come back down and then rest. You should not go from exercising and running, and then sitting down. That is not good for your heart. That cooling down is very important. Okay, so those are the 3 main things. Check your numbers, get your heart rate up when you're exercising, and then get your heart rate down before you rest. All right. So now I want to open it up. If anybody has any questions, please raise your hand, ask your questions, and let's talk a little bit about heart disease.
Okay, so if you have a question, I see Pulin uncle raising his hand. Uncle, તમે unmute કરજો.
Dr. Bhavik.
I saw you, Krishji. You can ask next.
Yeah. મેં 2016માં બાયપાસ કરાવ્યું હતું, ઓપન હાર્ટ સર્જરી. 3 બ્લોકેજીસ હતા. પછી એવરી 3 months કાર્ડિયોલોજિસ્ટને ચેક કરે છે, કાર્ડિયોગ્રામ કરાવું છું ને એવરી યર એકોકાર્ડિયોગ્રામ પણ કરાવું છું. એમાં એવરી યર 4 વર્ષથી જે એકોકાર્ડિયોગ્રામનો રિઝલ્ટ આવે છે, હાર્ટ ઇઝ વર્કિંગ 45 to 50%. તો એની સ્પેશિયલ એક્સરસાઇઝ ટુ ઇન્ક્રીઝ ધ
Yeah.
હાર્ટ કે
Good.
45
So-
to 50% જ
That's low. Yeah.
એકોકાર્ડિયોગ્રામનો
So
રિઝલ્ટ આવે છે.
what Pulin uncle is talking about is what percent of your blood is pumped out every beat. Normally the number is like 70% is normal. So his heart is every beat it's only pumping out 45 to 55% of the blood, and 70 is normal. Okay. So the easy answer in your situation, Pulin uncle, there's no special exercise, but a lot of exercises can do so. Even general exercise, even general cardio exercise that I was talking about, anything that's going to get your heart rate up a little bit, that will help. So there isn't any specific exercise like this is one exercise you do and that's going to make your number better. It's nothing specialized, but generally speaking, general exercise will work really well. Okay.
Every day I am walking nearly
Yeah.
5,000 steps or
Good.
2 miles.
But Uncle, this is a great thing. So even if you're walking 5,000 steps, those 5,000 steps might not be exercising your heart. You need to check the number. So if your heart rate is going up, and so Uncle, what's your age?
78.
220 minus 78. I'm gonna do the math right now, and I'll tell you what number your heart rate should go to.
હાથ ઊંચો કરજો પહેલા.
Okay, so if you're walking and your heart rate is around 106 to 110, that's good. That's exercising your heart for those 5,000 steps. If your heart rate is less than 106, it's not exercising your heart. You're just walking. It's good for your weight. It's still good for your, losing some pounds, but it's not exercising your heart. So if you want to exercise your heart for those 5,000 steps every day, your heart rate needs to be at least 106, between 106 to 110. That number you need to make sure your heart rate is at.
But cardiologist always ask when I visit, okay, you are
Yes.
walking
Yes,
5,000
because
steps or 2
so
hours.
that's the risk factor, because they just want to make sure that you are at least active and you're walking and you're keeping your weight down. Walking is going to be good for your cholesterol level. It's going to be good for your sugar level. It's going to be good for everything else in your body. But if your heart rate is not at 106, it's not good for your heart. It's just good for everything else. Okay. So walking is good. It's okay. It's okay if you don't like to walk fast. That's fine. It's still really good for you. Walking is always good for you. But if your goal is to make your heart stronger, you need to walk those 5,000 steps at a good heart rate.
Okay.
Okay, thank
Thank
you.
you. Thank you, dear.
You're
Hello?
welcome.
Yes.
Yeah.
Can a lack of sleep at night cause a high blood pressure?
Yeah. Can you repeat that question again?
Okay. Can a lack of sleep at night
And
cause
a
a
lack of sleep?
pressure?
Yeah.
Yeah.
Definitely. So one of the main risk factors for heart disease is stress. Okay. A lot of times when people can't sleep properly, it's because they're really stressed out, or it's because of anything else, right? And if you sleep well and you sleep properly, that will bring your stress levels down also. And all of that will be really good for your heart. So sleeping 7, 8, 9 hours a day is very, very important for one, stress relief, but then also really good for your body and your muscle functions to be better. And your heart is a muscle like anything else. So sleeping is going to be very good for your heart also.
Krish ji, you had a question?
Dr. Bhavik,
Yes.
can, can you please explain again about the calculation
Yes.
of heart rate, age
Yeah,
minus age?
everybody
Can you-
writes it down. 220 minus 60. Okay. So that is the maximum that your heart rate should go to. And that's like the maximum safe range. So from that number, you want, when you're exercising your heart, you want to be at 75% to 85%. Okay. So you take that 220 minus 60, and whatever that number is, you multiply that by 0.75. And that's the minimum number that you should be at when you're exercising your heart. Again, if you've had any kind of heart disease, like if you've had a diagnosis, if you've had a bypass surgery, if you've had anything else like enlargement of the heart, congestive heart, if you've had any kind of medical diagnosis, definitely talk to your doctors first, talk to your physical therapist who's working with you about this first. These calculations are more for general cardiovascular fitness, and it's to keep you healthy. But if you've already had an illness or already had a sickness, you might need more specific instructions. So this information is more general.
Thank you very much, Dr. Bhavik.
You're welcome.
Yes, Krish ji, go ahead.
Couple of questions. Of course, I got the thing on BPM or the beats per minute. As far as the blood pressure is concerned, you said 110 to 130, 60 over or 70 over 90 on the bottom.
Yeah.
What is the range that it should go up? Do you check the blood pressure also after exercise, or it's just beats per minute?
Yeah. Beats per minute is the easiest and fastest, so I like using that first. But you should always check your blood pressure, especially if you have heart disease. When you're exercising, you should check your blood pressure in the middle of your exercise. So while you're exercising, you should be checking your blood pressure. And then after you're resting and cooling down, you should also be checking your blood pressure. Now, it's normal for your blood pressure to go up a little bit. So if my blood pressure at rest is 120 over 80, when I'm exercising, it's normal for it to go to like 126, right? It's normal. If I'm doing something very, very, very intense, it might get to like 130, but it's not normal for it to go to like 135. Like that's too much of a jump. Okay, so a little bit of an increase is normal. Too much of an increase is bad, but then also a decrease, right? If my blood pressure is 120, but then if I'm exercising, if I'm running and I'm doing exercise and it goes down to like 114, that's also not good. All right.
Thank you.
Ajit aunty has raised her hand.
Okay. Yeah. Hello. Hi, doctor. I want to ask you one thing. If you have a pain right here, back of the neck, it is stress. It is because of stress.
I don't know why, but to relate this to heart conditions,
I don't think this
having
is
headaches,
related.
if you have a lot of
No.
headaches,
No,
I'm
never.
just explaining this related to the heart. So if
I
you have headaches
never-
and neck pain and pain down here, that could be a sign that you have high blood pressure, or that could be a sign that your body is in a lot of stress, and that might not be good for your heart. So
No.
my mother-in-law had this, she's been having neck pain for so long. And I told her, hey, you should talk to your cardiologist. And when we talked to her cardiologist, she had all of her testing done. They found that her blood pressure was not being managed properly. Then they did more testing, and then they found out that she had an aneurysm in her brain. And then she had a procedure to fix it. So if you have these neck pains, if you have these head pains, you should get it checked out. You should get it checked out. Like me talking to you, this is not me checking it out. You should talk to your doctor about this so they can do the appropriate testing. They can do the appropriate diagnosis of this. I can't diagnose your neck pain by looking at this. I need to see it differently.
Aunty, you need to see your doctor.
See your doctor. Talk to your primary care doctor. Most important thing, number one, most important thing is your primary care doctor needs to be your best friend. Okay, they need to be you need to trust them. They need to take care of you, and they're the ones that you should be telling all of this information to. So then they can look at it. If they find something off, then they can tell you you should talk to a physical therapist because it's just muscle, or you should talk to a cardiologist because this might be something different. Okay.
No, I never had a headache. Never. But only sometimes I have a pain like this
Yeah.
part. And anyway, I will ask my doctor actually.
Good.
Thank you so much.
You're
Thank
welcome.
you.
Doctor, hello.
Thank you. Thank you. Thank
Hello.
you.
અમુ આંટી go ahead, તમારો question પૂછો.
મારી એજ 86 છે.
Yeah.
અને હું જમ્પિંગની એક્સરસાઇઝ નથી કરી શકતી, તો મારે કઈ જાતની એક્સરસાઇઝ કરવી જોઈએ?
Yeah, great question. If you can't do certain exercises because number one, if your balance is not good, or if you have pain, or if you have a little bit of weakness.
No, I have no pain, anything pain.
Okay,
No
good. There's a lot of, you can do exercises in a chair. You can do exercises, sitting. You can do exercises in standing. It doesn't have to be jumping. Like even exercise in a swimming pool is really good for your heart also. So there's millions of exercises you can do, but you should talk to a physical therapist so they can teach you the best exercises that you can do safely. Okay. Because the good thing is there's a million exercises you can do. So there's so many options. So don't feel like you can't exercise. Everybody can exercise, but your exercise might look a little bit different. My exercises might be a little bit different, and somebody else's exercises might be a little bit different, and that's okay. But there will 100% be some exercise that you can do to get your heart stronger, but you might need to see a physical therapist so they can give you specifically the best exercises for you.
Yeah, winter માં ચાલવા તો જવાતું નથી. ઘરમાં ચાલીએ.
There's a lot of exercises that you can do at home. And like even right now, again, this is for everybody here. I do a lot of virtual online sessions with people and I exercise with them at home. So I've had multiple patients, even some of them are from this group, that I will teach them how they can exercise in their home with their space, with whatever tools or equipments that they have at home. And like I exercise at home. Like I do all of my exercise here. My gym is closed. So there's always something that you can do at home.
Okay.
And if you need anything, all of these virtual like teletherapy visits are 100% covered by Medicare. So this is something that everybody here has access to. Everybody here, if you have Medicare insurance, Medicare pays for like 15 to 16 visits a year. So you should use them. You should talk to a physical therapist, learn some exercises. They will teach you, they will look at your whole body and they will teach you these exercises that you can do also.
Thank you very much. Thank you.
Okay, thank you, doctor. Thank you, Kavita.
Yes,
Everyone.
Kavita.
Everyone, thanks.
Program bye.
Thanks, everyone.
Yeah, Amita ji, you have a question? And
Thank you.
मेरा क्वेश्चन है, मेरे जो हार्ट में पहले स्टेंट डला और उसके बाद मेरे
Sorry,
हार्ट में
I can't hear you. I can't hear you. Can you say it again?
My heart had like two problem. One is the stent is there in my heart.
Yeah.
And after 2004 and now in 2020 they found out like my two valves are leaking.
Okay.
And the doctor told me what's the reason, when my cholesterol, my weight, everything okay. Then he told maybe because I went through chemo too. So that chemo like damaged the wall. But he said it's not that serious. Only we'll keep a watch, and he allowed me to walk only 15 minutes. And I'm not supposed to carry weight.
Okay.
So my question is there, how can we stop this wall problem? Because I walk 15 minutes, then I get like a short of breath, so then I don't walk further.
Yeah.
So
this is great. I think this is a great thing for everybody here to learn. So she has a lot of these other medical things happening. She has a leaky valve, and that can affect your heart rate. That can affect your blood pressure. Leaky valves also make you at a higher risk of developing blood clots. So all of these things are things that can happen, right?
Okay.
But the important thing is, if you're checking your numbers, your blood pressure, if you're checking your heart rate, you're checking like your EKG and all of those symptoms, all of those numbers before you exercise, during exercise and after exercise, then your doctors or anybody can tell you if the exercise is good for you or if it's bad for you. Without having all of that information, we can't tell, right? But leaky valves and all of these things, exercise does help it if you do it the right way. And the only way to know if you're exercising and walking the right way is by talking to a physical therapist. It's like in your situation, you might need to do cardiac physical therapy at a clinic or a center just to learn, maybe like 2 or 3 sessions, so they can put all the monitors on you and they can make sure that your EKG is normal. They can make sure your blood pressure is normal while you're exercising. And then from there, you can continue that on your own at home. Yeah. A lot of this stuff, like even if you have the tools I was mentioning before, like the pulse oximeter, you can even get a watch. Like my watch has like an EKG sensor. You can also get a blood pressure cuff. If you have those things, you can do a really good like virtual online visit with somebody. And they would instruct you, okay, what does your EKG look like? Can you show it to me? And then a lot of these watches, they can send the EKG to your doctor, or you can send it to somebody, email it to people too.
Okay.
So you can also communicate that way.
Oh,
Yeah.
Okay, I have 2 people raised their hand. One is Rekha Bandari and Rekha Mehta had raised their hand. The question, and also Vinayak uncle is raising. Rekha Mehta, auntie, you have any question?
Yes,
Go
I
ahead.
had an open heart surgery and there is no cure because it's an unusual case.
Yeah.
એટલે એમાં મારા બે પગમાં બી ઇન્ફેક્શન થઈ ગયેલું હતું અને બે પગમાંથી બી વેઇન લઈ લીધેલી. એટલે આ 1994 માં થયેલું મારું ઓપરેશન. હજી સુધી કોઈ બીજી તકલીફ નથી, પણ તકલીફ ઈ છે કે હું બેઠા બેઠા જ કંઈ કરી શકું. આમ ઊભી રહીને કોઈ એક્સરસાઇઝ કે મારા પગ ઉપર વજન નથી જઈ શકતું. આઈ એમ ઓવરવેઇટ. તો બેઠા બેઠા હાર્ટ માટેની કઈ સારી એક્સરસાઇઝ છે?
So do you have any other issues, like any like joint problems, arthritis anywhere, anything like that?
Yes, arthritis, joint problem, blood pressure.
I think for you, I think you need to do like a one-on-one visit, because if you have these kind of issues, the problem is like I do a lot of exercises sitting down, but if I give an exercise, maybe for 10 people that might be good exercises, but maybe for you they might be the bad exercises, you know? So there's thousands of exercises that we can teach you that you can do sitting down in a chair. But if you have other problems from the past, you might need to get more specific exercises, more individualized exercises for you rather than a generalized list for somebody. Yeah. So the good thing is like there's a lot. So you can, even if you're sitting, I don't know, and don't do this if any of this hurts. You can like lift your arms. You can have weights. You can do exercises like this. You can do exercises for your arms going up and down. You can like lift your knees up and down. There's a lot. You can do like twisting exercises. You can do like reaching exercises. You can like bend and lift. You can do hundreds of exercises. I just don't know which are going to be the ones that will help you the most. If you're open to it, doing a virtual visit with me or doing a visit with somebody else in person so they can see your body move, and they can give you the best exercise that will work for your body.
Yeah, yoga ni કરું છું, ગુરુજીના ક્લાસ બી લઉં છું. Now I am working woman too, but now I am doing on the line.
Yeah.
Before in my job, I was always going to the APE and children with the exercise and the gym, but I sit only and I do it.
Yeah.
So that's helped me my heart, right? Because my doctor told me.
Yes.
Gujarati
you can also.
ગુજરાતી મને એટલું જ કીધું છે કે તું જેટલું જીવે ને એટલું નફામાં છે, કેમ કે તારા હાર્ટ નો કોઈ ક્યોર નથી. એઝ યુઝ્યુઅલ જે હાર્ટ હોય એની કરતા મારું હાર્ટ એકદમ નાનું છે, એટલે there is no cure. એટલે તું જેટલું જીવે એટલું નફામાં છે, એટલે તું તારી રીતે એન્જોય કર અને તારીથી જે થાય એ કરવાનું.
Yes.
એટલે
Yes. And that being said, that's true. Sometimes your body is your body. There's nothing you can do. That's an unmodifiable risk factor. But that doesn't mean that you have to just sit. Like you said, there's exercise. As long as you're happy with the exercises, you should be exercising. There's a lot of things you can do. There's a lot of arm exercises, leg exercises. You can get like a bicycle to sit in and then do your bike. There's so many things you can do. As long as you're feeling good and strong and healthy, and that's what's important. So for you, I think you should get somebody to teach you exercises that you can do for your body.
no, my personal exerciser man is coming to my home to give me a personal exercise and the water therapy too. So I go to the swimming pool in the water therapy. So that's much better. But my home, whatever I like, you say hand exercise is much better. Whatever I can do. Okay, thank you very much, sir. Thank you very much, doctor.
You're welcome.
I want to ask Vinayak uncle, Narendra Bhutala uncle, and I see Nathu Bhai uncle. Okay, go ahead.
So I'll go first.
Yeah, you can go first.
Yeah. Good morning, doctor. My name is Vinayak. I'm 70 years old, and my problem is having shortness of breath. It's happening for the last 5-6 years. During this time, 3 times I did an angiogram and nothing was found out. Last year, a doctor in India, in Pune, he said that you have a blockage on the diagonal artery, and he put one stent. Since that 1 year has passed, the shortness of breath has become less, but it's not gone off entirely. He has also suggested that there is calcification of arteries, which do not allow dilation of arteries to allow for more oxygen to flow when you exercise. So although I have the energy to do it, the minute it goes to 120 or so, my heart rate, then I start getting little tightness in the chest. What should I do for that?
So this is exactly when cardiac physical therapy is very helpful. So if you know that you're short of breath, you have this information, you know that when my heart rate gets 120, I get short of breath. In cardiac physical therapy, we would put like a hard stop. So we would make sure when you're exercising, your heart rate stays at like 110 to 115, and we would build on that. So if you can do that for 10 minutes, good. But now next week, let's try to do that for 12 minutes. Now let's try to keep it in that range for 30 minutes and keep on progressing it that way. The shortness of breath is many things can cause it, not just your coronary arteries. So you can have shortness of breath also because if your lungs aren't expanding properly, okay? So there's a lot of things that you can do to stretch your upper body and your back that can help your lungs expand. You can have shortness of breath because maybe your muscles, like the rest, like your arm muscles, your leg muscles aren't strong. Like if I'm doing some kind of squatting exercise and it's too heavy for me, I'm gonna be short of.
No, God frozen.
Oh,
It'll come back.
It'll come back. Yeah.
God, we lost connection with him.
Yeah, we lost connection with you.
Ask him if you could do a consult with him for a cardiac physical therapy.
He's telling me, but let us get back to him.
No, like a one-on-one consult.
I will give you that info. He's really good. I'll share.
Okay.
That would be
Kavita,
great.
we seem to have got disconnected. Yeah.
Dr. Bhavik lost his connection.
Yeah. Okay, but I got an answer, and we'll see if we can
He
do
may
it.
come back.
He's coming back. Dala had a question and.
So, Sonar,
You on mute?
No, I'm not on mute. I'll mute it.
Sorry, my internet cut out.
Yes.
Yeah,
Okay.
sorry about that.
So, they would like to do a one-on-one with you. I'll share your your info with
Yes.
them.
Yeah,
Yeah.
you can
could-
email me. I think there was somebody that asked a question earlier, but that question and the
No.
chat got deleted for me.
Oh.
Was there a
Buddha,
question in the chat?
let me see.
Rameshwarji wanted to ask question.
Okay.
Yes, doctor, I have a question, very short question.
Yes, sure.
It is may not be directly related to the heart problem. It is about blood sugar. If blood sugar A1C, it's got A1C,
Yes.
right? A1C blood sugar level is 6.1. Should I take diabetes medication? It is 6.1 say since last 4 years, the same level since last 4 years.
Okay. So generally speaking, I can't give you like medication requirements or modifications because that's not my expertise. That is not my training. That is not my knowledge. If your A1C is at a specific number over 6, it's like, you know, a sign that you're either pre-diabetic or something. So like that is something that you need to talk to your primary care doctor about. I know a lot of primary care doctors, before they recommend taking any kind of medication, they want you to try lifestyle changes. So things like exercising more, walking more, those are the two most important and most proven things to reduce your blood sugar and reduce your A1C. So a lot of doctors will say this, you know, before, you know, if you're borderline like that, before they put you on medication, they want you to exercise first and they want you to change your diet. So those are the two things. If you have a diet that you have questions about, you can find registered dietitians. These dietitians are trained, they usually have master's degrees in nutrition, and they can tell you, they can look at what you eat. They can tell you like what you need to change, maybe 1 or 2 changes you can make, and they can track all of these things down the line. I think like if you have like any kind of blood sugar issues, your primary care doctor needs to be involved. And if they know a dietitian, then they should send you to one, or you can probably find a registered dietitian. There's one person that I'm working with, like she's in California, but she's like an Indian dietitian. So she works exclusively with Indian diets. So she knows like what we eat. She knows like what kind of issues we might have and how to make changes. Be something that could be helpful for your A1C as well.
Thank you, doctor. Thank you so much.
Narendra, go ask your
Yes,
question. Yes. Ask your question.
I have a right side is pacemaker. So which exercise is good for me and how can I can wait?
Yeah. I work with a lot of people with pacemakers. The short answer is you can do every exercise. Your heart rate is going to be more regulated with the pacemaker. It might not increase as much, but there's other things we can look at. We can look at your oxygen numbers, and we can also look at your blood pressure. So even if your heart rate doesn't increase,
his blood pressure is always down, but he has a problem in the heart too. Okay.
Yeah, I know. But what my point in this is, just because you have a pacemaker does not mean that you can't exercise. I work with, like right now, I have 2 patients that have pacemakers. We need to do things a little differently, but for you, it's gonna be something like that. Like we need to just look at we have to look at your whole body, not just your heart rate. We need to look at your blood pressure. We need to look at your oxygen. We need to look at your flexibility, your strength. All of those things also matter. Your pacemaker obviously is a very important part of your medical history. So that needs the proper attention and the proper guidance. But that does not mean that it's a limiting factor. You have a pacemaker so you can be more active, not less active.
He does exercise all the time.
Good.
Yeah.
Sometime, whatever, night time I wake up early, so I cannot sleep even.
Yeah.
Okay.
That means he sleeps too much in the daytime. That's why.
Yeah.
Okay.
Yeah.
Okay. I think
I have one question, Kavita. I mean, Bhavik. How accurate these? I mean, I have app in my phone which we can measure oxygen or how accurate all these? I mean, gadgets is that safe to
Good
use?
question. They're safe to use for a general population. I like for most of these devices, they need to be like 97% within the range. So there might be a 3 to 4% error. So what that means is like if your phone is looking at your heart rate and it says it's like 100, it could be 96, it could be 104, but those numbers are, it's still a good range, right? So if your heart rate, if your phone is giving you oxygen number of 88, it can be either 90 or it can be 86. It can be a little bit of a range, but that's still gonna tell you if it's 88, you still need to take a break, you need to rest, you need to wait for the number to come up. If your heart rate on your phone shows up as 160, again, it might be 165, it might be 155, but it doesn't matter. Those numbers are still high. So you need to wait for it to come down a little bit. So for most people, these devices, even if they're not 100% accurate, they work really well and they give you useful information. It might not be the perfect information, but it's very useful.
Okay, thank you.
Okay. Anyone else?
So somebody typed a question, what is the calcium score? How does it help regarding heart condition? I'm not sure what you mean by the calcium score because there's many things that when you get your blood work done, they look at your minerals, they look at your potassium levels, your calcium, they look at all of your minerals. That is different than if somebody's looking at your bone density because that also is related to calcium. But specifically potassium, calcium, magnesium, manganese, all of these minerals that they look at in your blood levels, your blood panels, that all is related to how your muscles can contract and relax. So if you have like low calcium levels or low potassium levels, that might make your muscles a little bit tighter and a little bit stiffer. It can really influence how your muscles can move. So if that's what you're referencing, a lot of making sure that your electrolyte levels, your mineral levels are in a healthy range is very important for the health of your muscles. And your heart is a muscle, so it definitely influences that. Any other questions?
I guess not.
Okay. Good.
Very informative, Dr. Bhavik.